looks like those attendee participants are getting logged in here. So I will go ahead and get started. Good morning, everyone. My name is Rachel Sporletter. I'm the benefits team lead here with Larimer County. And today we are talking about open enrollment and all of the changes upcoming for open enrollment. A few housekeeping items before I get started. This is a webinar. So with that, it means you are unable to speak. So if you do have any questions throughout, most likely we'll wait till the end to ask those. But if it's pertinent to the information I'm covering, we'll go ahead and interrupt and answer those. But you can submit those questions via the chat or under the Q&A. And I've got Lauren, Kathy, and Jennifer. You've got the whole benefits team here, -1, to help answer questions. So if you see responses coming from them, that's who's answering your questions. So with that, we will go ahead and get started. This webinar is being recorded and will be posted to the open enrollment webpage later on this week. So, all right, 2026 benefits. We will do another active open enrollment this year. It will open on October 27th and will go through November 7th. It is another active open enrollment, meaning that you do need to enroll in benefits you want to keep for 2026. What's new for 2026? By now, I'm sure you all have heard, but we are moving from Meritain to UMR, and we are moving to the United Healthcare Choice Plus network. One thing to note is that is a nationwide network, so you're not bound to coverage just here in Colorado or even Larimer County. It is nationwide. And there is no provider disruption. What that means is that we ran a report of all of the providers that our members are seeing at the beginning of the RFP process earlier this year. And every carrier who responded to the RFP had to tell us how many providers fell out of network with them if we were to move our coverage to them. And from Meritain to UMR, 0 providers fell out. So that's what that 0 disruption means. And then next year, we will be offering 2 plan designs for our medical, the Surest Zero Deductible Plan and the HDHP. The Surest $0 deductible plan is no deductible, no coinsurance. It is only copays, which vary until you meet your out-of-pocket maximum, which for individual coverage is $5,000 and family coverage is $10,000. With the high deductible, we do need to increase that deductible to meet IRS regulations. So for 2026, the individual coverage will be $3,400, in-network individual deductible, and then family will be $6,800. And there are no changes to the HSA employer contributions. Here's a few plan comparisons I'll go through, comparing the Surest plan to the high deductible. So as you can see here, under the Surest plan for single deductible, it's $0. For the high deductible, it's that $3,400. Family deductible under Surest is again 0. Family deductible under the high deductible is $6,800. We do not have coinsurance on either of our plans, so you'll see that listed here as none. Out-of-pocket maximum for single coverage on the Surest plan is $5,000. High deductible is that same as the deductible, which is $3,400. And then the out-of-pocket maximum for family on the Surest plan is $10,000. And then $6,800 again mirrors that deductible under the high deductible. For the wellness clinic, copays for the providers there under the Surest plan is going to remain at $0. And then for the high deductible, it will be a $45 service fee if it's a non-preventive exam. Teladoc, which is a 24/7, 365 app where you have access to board-certified physicians. Under the Surest plan, it is a $0 copay. Same under the high deductible, it's a $0 copay. And then preventive care is covered at $0 coverage on all of our plans currently offered and the plans offered for 2026. Doctor's office visit. Under that Surest plan, as mentioned, it's going to vary. So depending on the care rating, it's going to be between $20 and $105. And then for mental health office visit, again, in-network only, it's a $15 copay. Specialist visit under the Surest plan is a $20 to $105 variable copay. Urgent care is $60 under the Surest plan. Emergency room is $650. Inpatient and outpatient hospital, again, there's a range between $150 and $3,000. And then massage and acupuncture is a $25 copay that is now open network with no dollar limit. And under the high deductible plan, you can see that all of these say deductible, which means you have to pay 100% of any medical care and pharmacy script that you receive until you reach that deductible. You are paying for those at 100% until you hit that. The Surest site, we have our own site that describes the Surest plan. You can scan this QR code here to see how the plan works. There's a webinar recording on there. They have some real life examples. We have medical terms, the premiums. We have FAQs, and I will tell you that we are constantly changing those and adding to those as we do these enrollment meetings. So take a look at those. Those FAQs might just answer your question. There's also a link on there about how to invite your provider, or if you want to check if your provider is in network. There's a link out there for that. And then coming soon, we should have it this week, our dedicated Surest website. With that dedicated Surest website, you'll be able to see the actual copays for physicians and services that you seek. And just so you know, you're looking at 2026 copays on there. So there's going to be no change, and they do not change throughout the year. So if you look up your doctor and see that there's a $50 copay, just know that that copay will be for every time you go in for an office visit and seek care at that provider. So once we have that website up and ready, we will send out a countywide email letting you know that, and you can go out and search. We'll also do another comparison here on the pharmacy. Just as an FYI, pharmacy is not changing. We will remain with CVS Caremark. And the Surest plan is mirrored to how our PPO plans look right now. So under the Surest plan for a tier 1 generic, you're going to pay a $10 copay. Tier 2 preferred brand is 20% cost share with a $25 to $50 copay. Tier 3 is going to be 50% cost share with a $50 to $100 copay. Tier 4, which are specialty medications, is a $100 copay, and those are limited to a 30-day supply. If you are someone on your plan takes a maintenance drug, something that they take each and every day, keep in mind, and you might consider mail order or retail 90-day supply. You would then only pay 2 times the copay and get that 90-day supply. So speak with your physician and or your pharmacist to take a look to see if your script could be written that way. And with the high deductible, you can see it gets very repetitive here. you do have to pay 100% of any of these costs until you reach your deductible. With moving to the Surest plan, we had to forego all of our $0 partnerships or direct contracts. So those are listed here. First one I will mention is Healthcare Blue Book, the rewards and the programs. That also does include the $0 cost share for the MSK program. So that will end on December 31st of this year. The $500 lifestyle education program will also be ending at the end of this year. The $0 Banner MD Anderson benefit, the $0 Family Care Center benefit, 8 free physical therapy sessions with Colorado in Motion. And you can see the last 3 I mentioned here are in blue. What that means is that they will remain as in-network providers. It is just no longer covered at $0. And then we're also going to end the $1,000 doula, Regenix coverage, Grail testing, and sensory deprivation. Those 4 UMR deems as experimental, so we're unable to cover those into 2026. And here are the medical premiums. So keep in mind, this is for full wellness. So you and your spouse had to qualify to obtain these rates, and you will see what well rate you fell into on the medical page in open enrollment when that opens. A few other reminders regarding the HSA. So the HSA, the health savings account, is only for those enrolled in the high deductible plan. You can see the chart here on the right, and these are the employer contributions. So depending on which coverage tier you elect for your medical, you can see the correlated amount on the per pay period. So make sure that you look at that. You do not get a lump sum anymore. It is a per pay period deposit. And then you can also contribute into the HSA, but it is not required. The IRS does set those annual contribution limits. So for 2026, for single or individual coverage, that limit is $4,400. For family coverage, it is $8,750. And if you are over age 55, you can do additional $1,000 catch-up contribution into that HSA, should you want to. Another thing with the HSAs is there is no use it or lose it. So 100% of these funds roll over year after year. And then if you do get your HSA balance up to $1,000, you can also earn interest and make investments within the Surency portal. And any interest earned is also pre-tax. Few other reminders with the flexible spending accounts. So the IRS annual contribution limit for the healthcare flexible spending account, which is tied to either the Surest or no medical election, it is $3,300, and that is a front-loaded account. What front-loaded means is that whatever annual amount you elect, if you do $2,000, as of January 1st, you have $2,000 front-loaded on your card to use within the whole plan year. There is a rollover maximum. That rollover maximum applies to our 2025 funds. So if you are currently enrolled in a healthcare FSA, take a look at your account on Surency. And if you are moving to the Surest plan in 2026, $660 will roll over. So take a look at that. Any amount over that will be forfeited. So make sure you estimate conservatively on that. And then for dependent care flexible spending account, the IRS did raise that limit up to $7,500. That is another use it or lose it account. But this is to be used for dependent daycare. This is not to be used for dependent medical expenses. That can fall under either the HSA or the healthcare flex spending account. We put together a quick plan comparison chart here. Surest is our vendor. I will say that, excuse me, we've had so many questions come up with this. So we are going to host an FSA HSA webinar. Actually, Surest is going to be the one doing that, but it will be October 22nd, and it is available out on the B board under events. So if you have additional questions on that, I highly recommend watching that and registering for that webinar. But I'll go through a few quick things here. As I mentioned, who's eligible under the FSA, that is the Surest plan members and non-HDHP members. For the HSA, it is HDHP members only. Who contributes? On the FSA, it is employee only. And on the HSA, it is employee and employer. And again, the employee contribution is optional. What expenses are covered? For the FSA, it is medical, dental, vision, prescription, and over-the-counter medications. And for the HSA, it is that full list plus COBRA and Medicare premiums. The FSA, is it an interest-bearing account? And that answer is no. Under the HSA, it is, again, once you get your balance over $1,000. Pre-tax deductions. Yes, the FSA is pre-tax deductions and the election amount is front-loaded. For pre-tax deductions, it is for HSA as well, but that election amount is per paycheck. For the FSA, is there a rollover limit? Yes, as mentioned, it is $660. For the HSA, there is no limit. 100% rolls over at year end. Can I have a dependent care FSA with an FSA? Yes, you can. And can you have it with the HSA as well? You sure can. Again, keep in mind that is for dependent daycare. Where can you verify expenses? FSAstore.com or HSAstore.com are great resources to use. There's eligibility lists on both of those. If you are also currently participating in either of these, you can download the Surest app. And on the Surest app, there's also a scanner on there. So you can scan any UPC code and it will tell you if it is eligible for an FSA or HSA. All right, moving into the dental plan. No vendor changes here for the dental plan. We are increasing rates slightly if you're covering dependents. So for employee plus one, the cost per paycheck is going to increase by $1. And if you're covering 2 or more dependents, that cost is going to increase by $2 per paycheck. Again, plan designs remain the same. Annually, we get a lot of questions about if we have a tiered plan or 2 different tiers to enroll in or choices under the dental plan, and there is not. We cover both PPO and Premier, but the PPO dentist are our best option when looking for a provider. Premier dentists, they are bound by a maximum plan allowance. So if you have a procedure done, let's say a cleaning for $200, and you're seeking care at that Premier dentist, and that MPA is $150, they could balance bill you for that remaining $50. So that's why you tend to hear from us. PPO dentists are the best option for us. And then should you want to see if your dentist is Premier or PPO or look for a new PPO dentist, the link is right here. One thing I didn't mention, but I will say it. If you are electing employee only coverage on dental, it is still 100% county paid. So there's no charge to you for enrolling in dental coverage. It's only when it comes to our dependents. All right, voluntary life insurance. This is still with the standard. And as this is probably a few years now where they allow us a small increase to our voluntary life insurance. So anybody eligible for benefits can increase their coverage by $20,000 as long as they remain under the $200,000 guarantee issue threshold. Our spouses can also increase by $20,000 as long as it doesn't put them over the $30,000 guarantee issue amount. If you are currently at zero, you've waived this coverage before. Please note that you can increase up to $20,000 with no medical questions asked. Same goes for you and your spouse and for children. And if you are someone who you have applied for this before and you have already filled out their questionnaire, those amounts are carried over, grandfathered over. So you should not see anything. You should see your current amounts listed in there and do not have to complete that evidence of insurability again. And that child guarantee issue amount is $20,000, no medical questions required. Kind of a blanket statement here for all of our benefits. Our children can be covered up until the end of the month in which they turn 26, where they will automatically fall off of all of our benefits. So nothing you need to do for that unless you want to remove them sooner than at the end of their 26th birthday. Also, all of our plans are a la carte. So if you decline medical for any reason, we don't really care what that reason is. You can still elect all of the other benefits that we offer. A few other things to be thinking about. Everyone will get new ID cards. We are hoping to have those mailed in late December to all plan member homes. If you do elect that Surest plan, there will be an app to download once we're enrolled in it in January. And then we are also going to have some how-to webinars in January. So look for those. If you are considering the high deductible health plan, know the total cost for the healthcare services you typically receive, including prescriptions, before selecting the plan. We've had a few people say, oh, I heard from a coworker that that's the best plan. So they enrolled in it and didn't realize that they have to pay 100% of prescriptions. I recommend if you are someone who is taking prescriptions, take a look at that total cost. That will show you what you're going to pay in 2026 on the high deductible. And then another thing the IRS tells us is you cannot contribute into a healthcare FSA and an HSA at the same time. So if you are changing to the high deductible plan, you need to get your healthcare FSA balance down to zero by December 31st, 25 to be eligible for the Larimer County HSA. And I will tell you, we watch this closely, so you'll get some emails from us if you are one in this position. And then even if you do decline to county medical, we get a lot, do I really need to do open enrollment? Yes, there's a lot in there other than just medical. And please verify beneficiary data for the employer paid life insurance. And also, you're eligible for all of the other benefits that we offer. So again, you decline medical, you want to jump on our accident plan or the voluntary life insurance, you are able to do so. A few things to be thinking about. Be sure to review your enrollment confirmation at the end of your enrollment. You can download it, email it to yourself, print it, whatever works for you. Take a look at that though and really review it and make sure that all of the dependents that you want covered are listed as covered. You can make any changes. If you're one that you go in the day that it opens and you want to enroll in your benefits, great. Jump in, enroll in all of your benefits, and then you change your mind on a benefit or choose to elect in a different plan. You can go through and complete open enrollment as many times as you would like. Just make sure that you go through and see that confirmation page at the end. If not, your changes have not been saved. So you can reconfirm as many times as you would like through November 7th. If you would like assistance with open enrollment, or you're scheduled to be out of the office, please email us at HR_benefits, and we will be able to assist you. New hires, we get a lot of questions about new hires too. New hires have 31 days to complete both of their enrollments. So we're going to have 2 groups going through pretty soon that have to elect for December 1st as well as January 1st. But they don't need to complete the open enrollment by November 7th. That deadline is for us as employees. New hires get 31 days to do both enrollments. All right, and here's where you go to access the open enrollment. So you'll go into UKG and select on, people call it, it's the 3 lines. It's really a hamburger, whatever you want to call it. So you click on that and hover over the myself icon, scroll all the way down to manage my benefits, or you can search for benefits. When you click on that, you should be taken to this screen where you can get started and you'll see how many days you have left to enroll in that coverage. If you click on that manage my benefits and it takes you to this plan source login, please close your browser and log back in on a different browser through Okta, just larimer.okta.com. We do not have plan source logins, but they are the background of our benefits platform. So they're associated with us. It just means something isn't working. So please don't call IT. Reach out to us at HR Benefits. Let us know that you're incurring this error if you continue to get it, if just changing the browsers does not work. And more about errors. If you seek any errors in your open enrollment, please take a screenshot and email them to us. It's much easier for all of us to figure out what's actually going on behind the scenes. All right. And as I mentioned, again, open enrollment ends on November 7th. It will open on October 27th. There will be a countywide email that goes out that day. Once we make sure UKG is running as it should. There's another QR code that will take you to our open enrollment page. We've got our booklet out there, which has all of the rates. It has our medical plan summaries, some comparisons, similar to what I posted today. And if you are someone who you're like, I just have some questions, don't want to ask at this public forum, definitely understand that. Just email us at that HR_benefits@larimer.org. Or if you would like to meet with someone, we are doing a lot of department meetings, as well as hosting a lot of office hours. But if your department isn't partaking in those and you would like to meet with one of us, emailing us at the HR_benefits, we will be happy to take a look at our schedules and see which one of us can accommodate a meeting. And that is the end of the presentation. I talked fast. I went through that fast. Looks like we've got some questions coming in. Looks like most of them have already been answered. Jennifer, Lauren, Kathy, anything that is open that I need to answer?
No, not that we're seeing, but we will stay on here for a few more minutes in case someone was saving their questions for the end of the presentation. So if you want to type those in the chat, we'll just sit tight here. And while we're doing that, Rachel, do you want to share your screen to show the open enrollment page for everyone?
Sorry, I muted myself for a second. Yes, I will do that. I need to stop the share really quick and then I will reshare because I was only sharing the presentation. All right. Yes, as Jennifer mentioned, if you have additional questions, please feel free to throw those in, and we will definitely get to those. This is our open enrollment website. You'll see the path listed here. This is not behind the B-board. I actually had an employee complain to me about that. And I was like, we actually want to keep this public. We understand that not all of our members are the decision makers on the benefits. So this is out here on our public page so everyone can see it. So it mentions our open enrollment period, where to handle questions. These are the open enrollment webinars. Obviously, this is today's. These are the remaining webinars. Here is that Surency webinar. We are hosting another webinar this Saturday. I will say, as of right now, we have not met registration requirements, so this is looking like it will be canceled, but we've still got a few more days. So if you know of someone who cannot make today's meeting or make next Tuesday's meeting, please encourage them to register for that webinar on Saturday. Next area here, we've got that open enrollment booklet. I believe it's like 57 pages, goes through all of our benefits in detail. So if you're a paper person, this is a great resource. Here are our open enrollment FAQs. I'll actually click into this one. These are being updated as we speak also. I know I mentioned that for the Surest site, but there's a lot of different questions going on in here. So take a look, should you want to, about our open enrollment FAQs. And then here are the UKG open enrollment instructions. And then there is that Surest $0 deductible plan. I'll click into that really quick and show you. This is that site that we sent out in the countywide email, but how it works. The Surest webinar recording posted here. Here's some real life examples and some copays. Medical insurance terms. I know that we understand those in this office, but might not be the same for you guys. So here's a few snippet, just terms. And then as mentioned, those medical premiums. Once we have the site built and ready to go, that will be listed here. Here's how to use the Surest site. Here's searching by price, Surest valued based on copays. Here's the Surest flyer, and then here's some comparisons, the transition overview. So this transition overview, just to show you, shows us current 2025 choice and standard. So if you really want to compare that, this is a great tool for you to use too.
Hey, Rachel.
Yeah.
Could you please show the link where we have the ability for you to search for if your provider is in network or out of network back on the open enrollment page? We're getting that asked a couple of times. So I thought it might be easier to just show folks here live.
Yep. So here on, so I went back to the main open enrollment page. Sorry, I know I'm clicking around here. Here is that find a UHC provider. And this is an active link here. I will quickly throw this website into the chat. Sorry, it wasn't very quickly. But you can click here and then I can run a quick test. And then next, item number 2 is click on medical directory or behavioral health, depending on which one you're looking for. But for this one, I'll do medical. And then we are employer or individual plans. And then as mentioned, we are the Choice Plus network. And then it will take you in. You can search for providers here. You can search for places. So if we want to look for, you can also see that this is going to default to 80, was it 222? But you can change that and update that location. So we can search for a provider here. Oh my gosh, I can't type. And you will see here, this provider is in network. Here's phone numbers. You'll also be able to search if they're accepting new patients or not, or if you know your provider is leaving. You can also just click on providers and what you're searching for. So I want primary care. I want to find a family doctor, and it'll list out all your results here. You can also then filter if you want to filter by adolescents, services offered, treatments, age expertise, availability for weekend appointments. There's so much you can filter by. And then here's more on the High Deductible Health Plan, back on that page. The medical plan summaries are listed out here, as well as the comparisons. Family Center Behavioral Health. So with FCC now changing from the $0 copay, here's a little flyer about how we still have that preferred access as Larimer County employees and our members, our dependents. CVS Caremark links to our CVS Caremark page. I will say if you are someone who you want to compare the costs, take a look at a few of these. There's how to enroll and get the app on your phone and be able to search for prescriptions. And yeah, that is the full open enrollment page. Anything else I should cover? Any other questions that came in that we should talk about?
Rachel, we did have one other question come in, and I'm happy to address this one. So it was just some feedback we've received in terms of certain staff having concerns around us switching to the United Healthcare Network, just because, they've been in the news recently and folks are concerned that they have high denial rate for claims. And so I think there's some confusion there because Larimer County is a self-funded health plan, which means ultimately at the end of the day, we actually just pay UMR and Surest to process and pay claims for us based on our plan terms. So we are our own insurance company at the end of the day as a self-funded plan. So it's not typical in a self-funded plan arrangement, whether it's through Meritain or through UMR, that you see a high claim denial rate, unless it truly is them denying a service that's just not covered on our plan. That's very different from what you hear about in the news in terms of a healthcare insurance company denying claims, because in those stories, it's actually the health insurance company who's taking the financial risk on and determining what claims should or should not be covered. So, um, we are not subject to that as a self-funded health plan, and ultimately, at the end of the day, we determine what claims would be covered or denied. If it was denied incorrectly based upon the terms of our plan, we have the ability to ask UMR or Surest in this instance to say that that claim was denied incorrectly and that it should be reprocessed and paid. So we have no concerns there at all whatsoever. So self-funded plans like our Larimer County Medical Plan, they're just very different from the fully insured plans that you hear about in the news. So just wanted to make sure I express that. We truly do not have any concerns there whatsoever. But appreciate your feedback and for sharing that so that we could discuss it with the group.
Great. Thank you, Jennifer.
You bet.
All right. It looks like all questions have been asked and have also been answered. If you do have another question, please feel free to throw that in the chat or the Q&A. We will remain on for a few more minutes. Everybody else, thank you so much for your time. As I mentioned, we will get this meeting recorded and posted to the website, and reach out if you have any other questions. Thank you so much.